This tutorial is going to be looking at the pathology content required for the MRCEM primary. So the four areas we're going to be looking at, wound healing. So primary healing is the healing that takes place with a surgical wound, for example. We now have a closed area. It's now isolated from the external environment, but we've got a lot of granulation tissue there. And this cartilage and woven bone has some strength, but also has a degree of flexibility. We're going to be looking at inflammation, the complement cascade, the kinin-kallikrein system, and prostaglandins. But then as a result of the vasodilatory action of the nitric oxide, the vessel dilates. We're going to be looking at some abnormal immune responses. So tissue damage has led neutrophils and macrophages to release a number of cytokines, and the inflammatory process is required for them to become present in the interstitial fluid. And we're going to be looking a little bit at shock. You can see how the purple is the systolic blood pressure starting to fall through stage 3 and more rapidly falling in stage 4 and stage 5. First of all, looking at the classification of shock. This is a helpful way of approaching shock.